Hello and welcome. I'm Masha from Mom Power Fit, and today I want to explain to you 360 breathing. So 360 breathing is really the foundational breathing technique to activate your deep core and your pelvic floor, and also to use that breathing technique during workouts, particularly during pregnancy, as you want to protect your core and your pelvic floor from too much intra-abdominal pressure, and also in your postpartum recovery to heal your diastsis recti and strengthen your core. So we're going to start in a seated position. And before I show you how to do the breathing exactly, I just want you to briefly visualize what this breathing is about. So why it's called 360 breathing is because we basically want to imagine that we're breathing into all the 360 degrees of our core canister. And our core canister starts at the pelvic floor and goes up until our rib cage, so including our diaphragm. And we want to imagine that we're really breathing into the full 360 degrees, so not only in your belly or not only in your rib cage or your back or your sides, but really into all the 360 degrees on our inhale. And as we exhale, we let that air out and let the pressure out so that really our entire core canister gets nice and tight. The pressure comes out of there, travels all the way up here and lifts off that pressure from our pelvic floor and from that lower core. So you're going to start in a seated position on a chair. I do like to take a pillow or even a soft Pilates ball on that chair as well. You don't have to do that, but it will make it easier for you to feel your pelvic floor again, because the 360 breathing is for all our core, and that includes our pelvic floor as well. And then I want you to place one hand here on your lower belly, just above your pubic bone, and one hand on the rib cage. And I want you to close your eyes, and I want you to inhale, take a nice deep inhale into that belly and that rib cage at the same time. So really feel like both of your hands are expanding. And then for now, don't do anything on the exhale. I really want to guide you step by step through it. So at the moment, we're just focusing on the relaxation part, on the inhale part. So again, inhaling, you want to feel your pelvic floor drop. It's touching the pillow like a hammock. Your hand here expanding, and your hand here also slightly expanding. Now, sometimes you might be breathing more into your belly, that you can see this hand moving more. Sometimes maybe you're breathing more into your diaphragm and in your chest, then you'll feel more your ribs expanding. So try these individual parts, and then also breathe into your pelvic floor. Let it fully sink onto this pillow, maybe wriggle a little bit around. So it's that perineum where you want it to feel on your pillow. So we're going to take 2 more breaths here. And again, we're focusing only on the relaxed part, only on the breathing in, only on the inhale. Focus. And now when you've gotten hold of that feeling as you expand, because you want to expand into all 360 degrees, we are now going to contract. So the way we contract is on the exhale, we want to actually let all the air out. And we want to start by zipping up from our pelvic floor, lifting that pelvic floor, wrapping up our core nice and tight like a little burrito, and engaging the core by exhaling and sending all that pressure out of that air that just went down. We want to now send it back up. Inhale and exhale. Inhale, let it fully relax. And as you exhale, notice my core. It's zipping up from the bottom up. My belly button is pulling inwards and upwards. And my ribs are softening and pointing down towards the hip bones without crunching, without gripping up here, but just a nice little alignment here and getting everything compact to take all the air out. So inhaling into your hands. And as you exhale, think about lifting the pelvic floor, lifting that belly button inwards and upwards. Ribs are pointing down towards your hip bones without crunching. Inhale, fully relax again, breathe into the hands. And exhale. Lift that air out of there. Strong core. If you're pregnant, it can sometimes feel a little bit confusing because you have the belly, and what I want you to focus on if you're pregnant is to really hold your belly down here at the bottom and think about on the exhale, inhaling again, same thing, you're just relaxing everything, you're breathing downwards. But as you are exhaling, I want you to take your belly and lift it slightly and hug your baby in towards your midsection and lift it. This is how you engage your deep core when you're pregnant. You hug your baby close to you on the exhale, inwards and upwards. Let the belly relax and exhale. Hug it inwards and upwards. So I want you to not just suck it in, but really lift it from the bottom up, from your pelvic floor. Your pelvic floor is helping you to lift the baby upwards and press it closely to you. So we're going to do a few more breaths. Inhale. Exhale, zip it up. Inhale. Exhale, zip it up. Inhale. Another cue is to play a little bit with your pelvic position. So especially when you're pregnant, your pelvis could be already tilting slightly forward. You could have that anterior pelvic tilt, but that could also happen postpartum. So if you are sitting like this with an arched back, notice to, on the exhale, to really tilt the pelvis back so that it's in a nice and neutral position. And then automatically you should feel here a slight engagement. Lifting in, lifting that belly button inwards and upwards. And the ribs are not flaring out here, but they're nice and soft and pointing down, and your posture is nice and straight. And that is the essence of 360 breathing. Now, what do you do with that information? So 360 breathing is really important to use during your workouts and during any strenuous activity, both when you're pregnant, especially when your belly is starting to get heavy and it's pushing down into that pelvic floor, and it's also pushing against your intra-abdominal wall and stretching those ab muscles apart, which is totally normal, by the way. But this gives your core, your deep core, a cue to stay active and to engage it and keep your baby tight so you can avoid a worse diastsis recti. Some level of diastsis recti is absolutely normal during pregnancy, but you can really practice that to manage that intra-abdominal pressure during workouts, but also during daily strenuous activities. When you're just getting up from this chair, engage your core. When you're walking up the stairs, so really learning how to both relax fully on the inhale, but also engage during workouts and strenuous activity will help you prevent a weaker core postpartum. And then also when you're postpartum, obviously when you need to work on healing that core, 360 breathing is really the foundation for you to learn before you add on any movement. Even if these are super safe deep core exercises like heel slides or toe taps, before you do them, before you do any movement, learn the 360 breathing and then practice it while adding movement. The next step will be then to learning how to hold this core engagement while continuing to breathe under brace. That means not holding your breath, very important. We're not holding our breath, but we are getting the pressure out of there so we can work with an activated core under load. We can do the exercises for longer by holding the deep core activation, but we can also manage heavier weights, for example, without a problem, without adding intra-abdominal pressure. So stay tuned for the next video on that. I hope you enjoyed that, and follow Mom Power Fit for more core, floor, and strength.